All right, good evening, everyone. Thank you so much for joining us tonight. My name is Jayme Chami, and I'm the epilepsy educator at Epilepsy Southwestern, Ontario. So as many of you watching might know, back to school can be a time of questions and concerns for all parents, but especially parents of students with epilepsy. And this year, COVID-19 has multiplied those questions and amplified those concerns. So to help address your concerns, Epilepsy Toronto, along with Epilepsy Southwestern Ontario, have gathered a panel of experts to speak directly to parents about returning to school this year. So today, we're very happy to welcome Dr. Elizabeth Kerr, who is the program director of the Epilepsy Classroom at SickKids, Steve Lynette, who is a member of the Special Education Advisory Committee, as well as a parent of a child living with epilepsy, and Carrie Charters, who is a registered social worker in the Pediatric Neurology program at LHSC Children's Hospital. And last but not least, Dr. Michelle Science, who is an infectious disease consultant at SickKids. So before we begin, just a quick note to our audience members. This webinar was created to be an interactive question and answer style webinar. So please feel free to actively ask questions that come to mind. We will try to get to as many questions as possible. We do ask that you refrain from sharing any personal medical information in the comments. So we'll get started. So to get started, we want to get to know our speakers a little bit better. So I'm going to ask our speakers to introduce themselves, as well as tell us about any concerns about going back to school, if any, that they've heard from parents. So I'm going to start going left to right on my screen, I guess. So we'll start with Carrie Charters. If you want to just introduce yourself a little bit more, explain what you do, and then let us know if you've heard of any concerns from parents about going back to school.
Hi, thank you for having me. I'm excited to be here tonight. I'm Carrie Charters. I'm one of the social workers in Children's Hospital over at LHSC in London, Ontario. And I have the absolute pleasure of working with a lot of our epilepsy families receiving service at the hospital. And I don't know a single parent in my entire life, never mind just in my work life, who isn't pretty worried right now. There's a lot of unknowns and there's a lot of questions, and it's been a long time since kids were back in class for those who are attending in person. So I think everyone's pretty concerned, and I'm absolutely hearing about some kids with some worries too. So I'm looking forward to addressing some of those concerns.
Yeah, absolutely. Well, thank you so much for joining us. This definitely was the longest March break ever.
Right.
All right, so next on my screen is Steve Lynette. If you don't mind introducing yourself and then also just sharing if you've heard any concerns from parents or maybe even yourself as a parent.
Okay, thank you. Good evening. So my name's Steve Lynette. I represent Epilepsy Toronto on the Special Education Advisory Committee for the Toronto District School Board. I've been on that committee for about 10 years and have been a previous chair and vice chair on SEAC. I have a daughter. She is actually grown, so she no longer goes to school, but her seizures started when she was 7 months old, and they are still quite active. Basically intractable, multiple seizure types, multiple medications over the years, multiple challenges. But in spite of all those, she has graduated from college and is working now at the TDSB soon, once things get going again. And the point of all that is there is always a chance that things work out, and that most of these kids that have seizures are some of the toughest people you're ever going to meet.
Yeah, absolutely. Oh, sorry, Steve, continue.
No, that's about it. As far as concerns I've heard, mainly just concerns about don't know what to expect, don't know how many kids are going to be in a class, don't know what it's going to be like, don't know how they're going to be able to pay attention, don't know how long they're going to be able to last sitting in one room for so long. We'll have to see.
Yeah, absolutely. Well, thank you so much for sharing and for sharing a little bit more about your personal story with epilepsy. That's really great to see you're so involved with the community. That's awesome. So next we have Dr. Science. If you don't mind just introducing yourself and sharing if you've heard any concerns.
Sure. Thanks so much again for having me. So again, Michelle Science, and I'm an infectious disease physician at SickKids. And at SickKids, I work as the medical advisor for infection prevention and control. So in that role, I've been involved in the hospital response to COVID-19, and then more recently involved in the SickKids guidance document around return to school. And I think, similar to what Carrie had mentioned, I guess I just start by acknowledging the anxiety and uncertainty around return to school. Children have been out of school since March. And at that time, we were told to stay home as much as possible and follow all of the guidance. And this was a really important step to take at the time. But now we're at a different stage of the pandemic, and it's important to relook at returning to school with the enhanced safety measures, the enhanced health and safety measures. So I'm here hopefully to answer some of your questions about some of the precautions that are being placed in schools.
Yeah, that's great. Thank you again for joining us. Hopefully you can help answer some of those concerns about the unknown. And last but not least, Dr. Kerr, if you don't mind introducing yourself and then telling us if you've heard any concerns from parents.
Hello, everyone. So I am at SickKids as well. I am a neuropsychologist with the Comprehensive Epilepsy Program at SickKids, and I'm the Director of the Epilepsy Classroom there as well. And, I just have to reiterate what everyone else said is just about the uncertainty that people are feeling, and even trying to make a decision without having the answers of what's going to be best for their child, or whether they should be doing online learning or going in person, and being comfortable in the decision that they made. And I guess the other one is just the extracurriculars. So much of school life are the extracurricular activities and what's going to be happening there.
Yeah, you bring up a really, really great point, the extracurriculars. That is definitely a concern lots of our parents have. So thank you everyone for introducing yourselves and sharing. We're going to get the ball rolling. So our teams have come up with just one question right now for each of you. And once I ask all those questions, then we'll get to the audience questions. So audience, if you have any questions, please feel free to comment them now. So I'll start with Carrie. So our question for you to get the ball rolling is, how does the return to school impact the whole family system? And what strategies would you recommend for families trying to navigate this new normal? Oh, I think you're muted, Carrie.
Like I've never been on a Zoom before. And what a question that is, Jayme. Every family is going to be impacted in every different way. Every family member is going to experience change differently. Families are going to experience this differently, whether they've made the choice to go back in person or to stay at home and learn. Some families are doing that through boards. Other families are venturing into homeschool for the first time. I've heard all kinds of different plans from all kinds of different folks. What I've been telling people is you've made the best decision that you can for your family, and that's really important. Sometimes it's really tempting to say, well, we really have to protect our child with epilepsy or our child who is sick. And I think some of the other experts with a lot more knowledge than me will address those concerns. But what I would definitely say is that it's really important for all of the children in the family to know that their health is important, and that a decision that's being made is being made so that everyone in the family can stay healthy and safe, not just for the child with epilepsy, right? Because we actually don't know a whole ton about this thing and how it affects different people. And I look forward to hearing from some of the doctors on that for sure. So in terms of handling this, I think it's the same way that we handle all the stressors that we handle in our lives. And families with epilepsies, I think, have a lot of those skills, probably more than the average family does. I think we go back to basics. So we go back to making sure that our physical wellness is intact, making sure that kids are getting exercise and getting fresh air where possible. I know that can be really tough in the city where there's not always a ton of green space available, but I think people get pretty creative. Making sure sleep, I think during this really long break away from formalized programming, I've heard from some families that kids are going to bed a little bit late, really trying to slowly and incrementally work that bedtime back to a place where, folks are going to be able to get up in the morning again. I've never heard it go well to suddenly the day before school say, you're going to bed 2 hours later or 2 hours earlier. It's not going to go super well. So really try to plan ahead and do that incremental work as a family. And when you're making new plans and routines as a family and getting back to those things, trying to work as a family team instead of a dictatorship usually helps as well. Remembering that our kids have a lot of wisdom about what their needs are and what they're capable of, and being able to work together as a family is great. So co-creating routines is great. Focusing on health and wellness is great. And above all, talking about what's going on for your family. If you're noticing that someone's looking worried or maybe not acting as themselves or as they have been this time, addressing that in a really gentle way. I've noticed you've been a little bit different and I'm wondering if you're feeling worried. Honoring it if they tell you that they're not feeling worried and not pressing it. But if they are kind of saying, you know, I do have some worries, talking about them, validating them. And this is the hardest thing for the parents I work with, not trying to fix them immediately in the moment. Parents, I think, you know, the thing that we want most for our kids is to protect them and to help them and to try to clean up the world for them a little bit. And gosh, this world right now, any cleaning up is great. And we always want to do that. But I think what a lot of our kids need is just the time and space to be with how they're feeling and to have that acknowledged and validated. So really try to slow down and acknowledge those feelings that are coming up and then work on a plan together to address them.
Yeah, those are all fabulous points. Those are really great. Thank you, Carrie, for sharing that. So our next question is for Dr. Science. So the question is, are people with epilepsy more vulnerable to COVID-19?
So that's a really great question. And maybe I'll start by talking about children first and just mention, you know, we continue to have strong evidence that the majority of children and youth who become infected with SARS-CoV-2, which is the virus that causes COVID-19, are either asymptomatic or have only mild symptoms such as cough, fever, and sore throat. So this is really reassuring from a pediatric point of view. With respect to underlying medical conditions and epilepsy in particular, we currently don't have any evidence that having epilepsy alone increases the risk or severity of having COVID-19. What we do continue to see is really age is one of the strongest risk factors for severe disease, with, as many of you have probably read, the older age groups having a higher mortality than the younger age groups. But as far as I'm aware from the evidence out there, there's no evidence that epilepsy alone increases the risk.
Okay, that's very good to know. Hopefully a lot of our parents are breathing a sigh of relief there for sure. Okay, so Dr. Kerr, if children are learning from home, how can their parents better support them?
That also is a really good question. You know, I think first of all, if you've chosen virtual learning, you're not alone. My understanding from principals across Ontario is that a large number of families in general have chosen that option. So building on Carrie's point is that children and youth really thrive with routine and structure in your home for school learning. So you want to designate a learning space. You want to set out the day that includes a time months. You want to slate in when the instruction is actually taking place. And then you have the breaks from the screen for fresh air and exercise. Another important thing that you can do to support your child is to reach out to your child's teacher and set up a virtual meeting, just as if your child was attending school in person. You may want to outline what the teacher needs to know about your child in order to work with him or her. If your child has learning differences, you might like to highlight his or her strengths and then also address the specific concerns that you have and ask for suggestions on how to support your child in the virtual environment. And then finally, my recommendation is to be patient. You know, is a lot of uncertainty. I think there's a huge learning curve for everybody involved across the world, not just you're flexible. So set a flexible mindset and recognize that the maturity level and learning style of some children might not be sufficient for independent virtual learning, and you might need to help out a bit. So again, I guess it's patience and letting yourself and your child off the hook.
For sure, being a little kind to ourselves as we navigate this new world, for sure. Thank you for sharing. And Steve, so based on epilepsy being deemed a prevalent medical condition with the ministry's PPM 161, what strategies can parents use with their school if they receive any hesitation surrounding administering rescue medication and or following a student's seizure management protocol?
That's a long question.
It is a long question.
It's extremely relevant because we do run into situations where, in addition to students not being allowed to go on events, there is a great reluctance to administer medications. To back up a little bit on the history of this, in 1984, July 19th, 1984 was when the Ontario Ministry of Education created a policy called the Provision, sorry, I have to read this, of Health Support Services in School Settings. And the key line in that policy says, the school boards are responsible for the administration of oral medication where such medication has been prescribed for use during school hours. So that's been in place since 1984. At the TDSB in Toronto, their policy called medication wasn't created until the year 2000. So there is a long delay in getting these things in place for us. What's really important is to keep notes. First of all, if you think there's going to be a problem and you run into a problem, keep notes. Write it down in a notebook, use your phone, write it down on anything, stick them all in one place, but keep notes. Another really important thing is to be very calm. If they say, no, we can't do this, you can simply say thank you to the teacher and go and speak with the principal. If the principal says the same thing, you can say thank you for your time. I will contact the area superintendent and the superintendent or associate director involved in special education, and let them know that you're doing this, and keep notes on what the conversation was about. If possible, make sure there's someone else with you, so it's not just a he said, she said. You have someone to support your case. There are also a lot of documents that you can get your hands on. The TDSB has at least 5. Their procedure is called PR 536. And there are parts A, B, C, D, and E all need to be addressed. One is a permission form from the doctor stating what the condition is, stating what the prescription is, stating when the medication needs to be taken. So if you can get these things dealt with ahead of time, when you know your child is going to need the medication, have that letter ready, have photocopies of the labels of the prescriptions in case they take multiple meds at multiple times. It's pretty hard to deliver one day of medication in 4 different prescription bottles. It's much easier to have it in one. So provide them with the information they're going to want. Get the letter of authorization from the school board signed and ready to give back. Also, this is something that I have used in the past, even without the prescription, the giving of medication issues, is have a plan of action written out that says, is basically steps to take if my child has a seizure. Start with what they look like, when they might happen, what kind of seizures they have, how long they last, what to do after a seizure. Find out what the rules are for sending a child to hospital. Some school boards say everybody has to go. when you're having these challenges, always remind them of the official document, the provincial PPM 81, which has been in place since 1984, the local policies and procedures of your school board. I've had a chance to look at the Toronto board and the another one, and I forget which one it was. It might have been Thames Valley. They all have some documentation that you can download, have it filled out, and bring it with you to a principal. And if they refuse, like I said, continue going up. The other thing I really think would be great for you to do is to contact your local epilepsy association, find out who the SEAC representative is, if the Epilepsy Association is represented on SEAC, and arrange to get in touch with them. Sometimes that will help with an extra conversation through SEAC to, not necessarily through SEAC, sorry, because it's an advisory committee on general policies, but we know who works at the board. We know what situations are like, and we can certainly and are happy to guide you through the process to make sure that it's a successful outcome, that your child does get the medication that's required, because it's in some cases life or death. You need it or you're going to have seizures. So take notes, keep notes going through all the way, have someone with you when you have these conversations. Be polite, be professional, don't give any reason to be objected to, and simply work your way up the ladder. Reach out to your local epilepsy association and SEAC members, and anyone else that you know who's a parent or who knows about seizures. They will be a support for you. And usually that is what's going to make it work.
Yeah, thank you for sharing, Steve. That was a very great answer with lots of really important information. It sounds like having a proactive approach as opposed to reactive is really important for parents. I'll just remind our audience members, if you do have any questions that have come to your mind, please don't hesitate to write them in the comments section, as we'd love to hear from you. So we do have a few questions so far. So the first one says, with the new requirement of children wearing a mask during the school day, is there any increased risk of a seizure for a child who is otherwise well controlled on clobazam once daily? This child has a history of generalized tonic-clonic seizures, mainly at night, and they've been seizure-free for a year. That's awesome. The person said, I am happy they're going to be wearing masks, but this is a worry. So it looks like the question is wearing a mask during school day, is there a risk of seizures? I'll open that up to any of you guys.
So I'm happy to start, and then anyone else can feel free to jump in. So with respect to masks, I would say, in general, it's not, they're not felt to be side effects of wearing the mask. From the point of view, I've had people ask, will it lead to changes in my oxygen level or hyperventilation, those sorts of things. So in general, there's no evidence to suggest that wearing the mask would result in any changes in the oxygen levels or breathing or otherwise in children. I would always encourage people with concerns to talk to their healthcare provider about their specific child's situation. But in general, it shouldn't lead to any changes in oxygen level or lead to further seizures. Some people have also expressed that stress and otherwise could lead to, could be a trigger, and wearing a mask can be a source of stress. And I would encourage people to try to get their children accustomed to wearing masks for brief periods at the start, and then you can gradually prolong it as you get more used to the feeling of having the mask on the face. So those are just some strategies that we've been using. I'm sure others have other thoughts as well.
Yeah, those are great ideas. Thank you for sharing. If nobody else has any comments on that, I will move on. So the next question is, are there any medical bracelets specifically for epilepsy that parents can order? I don't know if Carrie, you know anything about medical alert bracelets. If not, I can also speak to that.
It's Steve speaking. Hi.
Sure.
We went through a lot of this. We actually ordered a medical alert bracelet, but just the medallion. And because my daughter, when she was much younger, would not wear a medical alert. So we got one like that, and she wore a sports bracelet. You can buy them from Medical Alert. They are actually a sports band, so they are not overly fancy as far as jewelry goes. After that, she ended up getting as a gift a Pandora bracelet, and we took the medallion off her Medical Alert bracelet and put it on the Pandora bracelet. And now it's a fashion item and she wears it almost all the time.
That's awesome. Yeah, they definitely, if you check out the Medical Alert bracelets, they definitely have come out with quite a few fancy ones and a lot of kid-friendly ones. So, and also if you do need financial assistance, please don't hesitate to reach out to your local epilepsy agencies because we can help you navigate through that. All right, so next question is, can you comment on who would administer medication at school? I was told that we can't administer meds. A nurse has to do that. Is this true, specifically in Toronto District School Board?
Okay. I take it this is from a teacher or is it a parent?
I think it sounds like it's a parent.
Okay, well, a parent, if you're in the school with your child, you should be able to, but a teacher or any staff person can and should administer the medication. If your child was to go on a field trip, for example, with staff and teacher supports, but you are not with them, there is a teacher there that will be dedicated to give your child that medication. If it's something that you want the office to deal with, it could be a vice principal or a secretary, but it easily can be the teacher. But keep in mind, the medication will be stored probably in the office for the child at the time they need it.
Okay, thanks for clarifying, Steve. That's helpful. Okay. The next question is, it says, I understand that children with epilepsy are not at increased risk of adverse outcomes with COVID. Are you able to comment on whether epilepsy is an extra risk factor for adults? Both my sons, one who has epilepsy, are returning to in-person learning, and my husband also has epilepsy. I'm concerned about my children bringing it home to my husband.
So that's another really good question. And it's the same thing that I'm aware of for both adults and children, that epilepsy alone, there's no evidence to date. And of course, we continue to monitor very closely. But as far as I'm aware, there's no evidence to suggest that epilepsy alone would increase the risk in either children or adults.
That's great. Thank you so much for clarifying that. Okay, the next question is, as someone who is newly diagnosed, what's the best way to approach teachers about having epilepsy and my needs? Anyone feel free to comment.
I'll start,
Sure.
but I think some of the other folks might have some great ideas too. The first thing I'm thinking is that question sounds like it's from a teenage person. And I love that we've got someone reaching out for information for themselves and advocating and being proactive in thinking through this. I love that so much. Welcome, glad you're here. And so I think, that conversation is best broached the way that we approach sensitive stuff with anyone, which is to ask for a private conversation. You don't have to do things like that in front of lots of people. And you can just kind of as succinctly but clearly as possible say, this is what I'm dealing with. This is what it looks like for me, because of course, epilepsy looks different for all kinds of different people. So even someone with a basic knowledge of epilepsy is going to want to know more about how it impacts you. And I think you can highlight for that teacher what your big concerns are, and then ask them, what can you do to support me? Who do we need to talk to make sure that we have everything that we need? So I think we want to invite people into the conversation while understanding that the teacher might not have all the answers in that moment, and making space for that conversation to be to include other people, to make sure that your needs are being met, to make sure that the teacher understands what's needed. And of course, you can also always reach out to your local epilepsy organization. Jayme's like, yes, you can, for support in those conversations as well. They're wonderful with that.
Awesome. Thanks, Carrie. That's great. Great answer.
So I'll just add that I think informing teachers can really be empowering for you or for your child if it's a parent, because it's going to increase the teacher's confidence in managing seizures if they happen in the class, and supporting the child or youth academically and socially. So the conversation is really important. And, although teachers and other school professionals aren't healthcare professionals, they do play an important role in supporting and ensuring the safety of all students, and particularly those with epilepsy.
Yeah, absolutely. Thank you for your input, Dr. Kerr. Okay, lots of questions here. So the next one says, before COVID-19, one of my child's accommodations was to have a buddy system. When my child had to go to the washroom in case a seizure happened, his buddy could go get an adult for help. Now with COVID-19 and social distancing within classrooms, can this accommodation still be in place?
Hi, I will give this a shot. I think, as the previous question related to talking to your teacher about your situation, this is something that should be brought up proactively with the principal and the teacher, and explain the necessity of it. When we think about the AODA, the Accommodations for Ontarians with Disability Act, undue hardship is the measuring tool. I cannot see that having one child escort safely another child to the washroom as anything even close to undue hardship. So it should be possible, but I would want to arrange it and have the discussion ahead of time.
For sure, that makes sense. Thank you, Steve. Definitely being proactive is important. Anybody else has a comment, feel free to chime in. If not, I will move to the next question. So the next question says, if a child has a seizure at school, what is the protocol for teachers in terms of seizure first aid in relation to physical distancing due to COVID-19?
So I think it's going to vary from different boards. The teachers all know that they need to respond to students' needs. And there's sort of a bundle of health and safety measures which each school is implementing. So the teacher will be masked. They'll probably be wearing a shield, but because they'll be within 6 feet distance, they may have gowns to put on so that they can go and support the child, so that they will be supporting your child, and they'll be aware of that. So that's one of the reasons that at the beginning of the year, you want to be able to set up a meeting with your teacher, talk about what your child's seizures look like, how frequently they occur, what to do if a child has a seizure, and what the teacher can say to other students in the class so that they don't become alarmed. So I guess it's just that open communication again, but teachers will be responding.
Awesome. Thanks for sharing. I'm sure that definitely helps ease a lot of parents' nerves that, the protective equipment is there for a reason.
There is something else that we can all remember is depending on the age of the child and the conversation that you as a parent have with the teacher and perhaps the children, the classmates can also play a role in supporting them. You know, my daughter had one years ago. It was not COVID, but one child yelled out, "She's having a seizure." Another child said, "I'll time it." And a third one said, "I'll call the office." And the teacher simply said to us afterwards, she goes, "I was amazed." And so the proactive conversation ahead of time created a team of caring peers that wanted to watch out for their classmate. And she said, "I just had to go to the kid and that was it." So have those conversations with the teacher, have them with the kids, and let them know what happens so that they're not going to be afraid of what they see, and nor will the teacher, hopefully, but they'll be prepared to say, "Wow, we've got to help out here."
I love that. I love that. Yeah, I often get teachers asking me, should the kids leave the classroom? And I always encourage them, hey, involve them in seizure first aid if you can. And like you said, maybe with social distancing, that might be just saying those things out loud. But I love that. I love that. Okay, next question is, what resources can parents bring to their child's teacher to help advocate for their care while at school?
So I'll just take a stab. About Kids Health at SickKids does have some materials on epilepsy and specifically regarding epilepsy at school. It covers a broad range of issues, including really talking about, it's directed towards parents, but it does talk about what teachers and other school personnel need to know about epilepsy. And so I think it gives a place to for the school to understand what epilepsy is about, why you're sharing your child's information with the school, what they might expect, like fatigue, for example. So the About Kids Health is a really great resource.
That's great, thank you. Anybody else have any ideas for resources to share with the child's teacher?
Jayme and everyone, again, contact your epilepsy association. Yes, Epilepsy Toronto has over the years had dozens of different types of pamphlets, books for adults, for teens, for caregivers, for teachers. Find out what they have, because they probably have a lot that you can take and hand to the teacher and to distribute to other staff in the school. Make everybody aware of this issue. And as I mentioned before, I think Elizabeth has hinted at this too, is what happens when your child has a seizure? What happens before they have one? What happens during? How are they going to feel afterwards? And give the teacher the best picture you can of what it's like to go through it, and have that written down as part of their safety plan as well.
Absolutely, yeah. To reiterate it, please don't hesitate to reach out to your local agency. Just because there's COVID doesn't mean we're not here. I have done myself countless presentations online to teachers already, so please don't hesitate to reach out. We are still here for you. Okay, let's see. The next question is, what are the possible long-term effects of COVID-19 in children? Maybe Dr. Science, you might be the best to answer that one.
Sure, yeah, I'm happy to get starting. So I guess first, most people who have coronavirus, COVID-19, recover completely within days to a few weeks. But some people, even those who have had mild versions of the disease, may have some or may experience some symptoms after the initial recovery. And So far, again, the evidence continues to evolve and we continue to learn more, but it does seem that older people and people with serious medical conditions are most likely to experience lingering symptoms. And those include things that we see with other viruses as well that can linger. So fatigue, cough, shortness of breath, headache, and some joint pains. So it can happen, they can be long-term. It is a disease that primarily seems to affect the lungs. It can go to other organs as well, but we're still learning more about what that means. But by far and large, the majority of people recover completely within days to weeks. And we will continue to monitor the lingering symptoms and what this means. And it is important that people that have had COVID-19 continue to be followed by their physicians to make sure that everything is recovering and functioning properly. But overall, as I said, most people do make a full recovery and these lingering symptoms do happen, but we're still learning more about them as the situation evolves.
Okay, yeah, thank you for sharing that. That is promising. That is great. Thank you. Carrie.
It might be worth addressing too. I think I've heard lots of talk culturally about some fears about, what are our kids going to be like after this? There's been a lot of isolation and there's been a lot of time away from friends. And like, I've got an 18-month-old who hasn't been to a grocery store in 6 months, and I think he'll be really surprised at just how many people there are in the world when we venture back out in that way again. He'll be like, wait, what? There's so many humans existing. And I think if we really kind of think about, I can't promise anything, but what I can say is that humanity has managed pandemics before. We've managed all kinds of big cultural events before. And I think when we come down to the family level, what we want to focus on is the way we get through anything, which is through secure attachments with our caregivers. And I think the more that families can focus on cultivating that, on being that safe space for kids to come home to in an uncertain world, is the best way to do that. And a resource that I like to talk about if you're interested in thinking about how we cultivate attachment, and especially how we continue to do that with older kids and youth, or maybe how we pull them back when they've been spending a lot of time on screens or Snapchats or TikToks or whatever it is that they're spending their time with online, is a book called Hold On to Your Kids: Why Parents Need to Matter More Than Peers. It's by Canadian doctors, Dr. Gordon Neufeld and Dr. Gabor Mate. They're wonderful. And the book does a really great job of making a case with all these books. The first few chapters are making a case for why this matters, but it really gets into some great stuff in the last two sections with some really good how-tos. And they kind of note 6 ways to build attachment that I think are so valuable. They talk about proximity, so really spending time together, doing things together. Even if you're all stuck in the house together, everyone's on their screens, well, let's cook a meal together, or let's spend time doing activities that you enjoy. If you're that into YouTube, okay, I'll watch your weird YouTube show that I don't understand, because that's about time together. Sameness. So sometimes that means, now that we're all venturing back out into the world, we might miss each other a little bit. So how about on Tuesday, we all wear red and we know that we're all going into the world with that connection as a family. Belonging and loyalty. So reminding that we are, right? So that sameness can do that, but also just reminding, oh, you're feeling worried. Sometimes I feel worried too. And sometimes families experience some of those same feelings, and reminding that we're not alone and that we are kind of connected in that way. Significance. So that's really making ourselves vulnerable as caregivers and telling our kids why they're so important to us, or what it is about them that is meaningful to us, or even just naming, I really missed you today and I'm so glad that we're back together again. Feeling, so that's naming and validating those emotional expressions and helping kids to organize the very complex feelings that we have in a complex world. And being known. So really identifying, oh, you really like that song. It must have been nice to hear that today on your way home from school, or just things that you notice about your kids that remind them, oh, my parents might be really uncool, but they know me and they get me, and that pulls them back in. So that's a book that I really appreciate, and that I think is absolutely worth a pick up if you're thinking, gee, how do we reconnect as a family, and how do we rebuild that in an uncertain and sometimes scary world? Hold On to Your Kids.
I love that. That's awesome. Sounds like a really great resources for parents. That's great, Carrie. Thank you. All right, so the next question, it says, my son's symptoms of seizures are somewhat vague, and he has a difficult time differentiating symptoms of sickness from symptoms of seizures. This school year, it seems especially important that we can tell the difference between being sick and having a seizure. What can I do to help my son articulate what he is feeling to the teacher so we can determine if that is a seizure? Typically, his tummy feels unwell. He has a headache, his face flushes. All things that can also come with sickness. We'd like to avoid any panic around mixing up his symptoms with symptoms of COVID or other illnesses. Anybody feel free to chime in.
So I would say, you know, it's probably, I appreciate the challenging situation that is. And I would say that this is where it comes back to what many of the other panelists have already discussed, but the open communication and discussions with the school and with the teachers sort of early on, so that those discussions can be started. You can involve the healthcare provider or the primary care physician for your child as well in those discussions, just sort of differentiating the usual symptoms or baseline symptoms of the child compared to those of COVID-19. And it may be that at the beginning, if there are signs that are a little bit harder to differentiate, that there may be a need to do testing early on. You know, those are discussions that would be important to have with the healthcare team as well as the school.
Great point, thank you. Yeah, definitely open communication sounds important for sure.
I guess the other question to ask the questioner is, does the seizure presentation evolve from what was just described, the tummy ache, the flushed face? Or how long do they last? And really pay attention to see if you can determine, okay, this stomach ache is lasting longer than it would be if he just wasn't feeling well. His face is redder or more flushed, or what part of the face is more flushed than the other ones? And does it evolve into something else? If it does, how long before they fall down, so perhaps? And again, have that conversation with the teachers so that they know how much time they have to determine what's going on or not. And it's a real comfort to know, okay, they're starting to show, but nothing happens at least for another 30 or 40 seconds, so we can sit them down, you know. And maybe that's all it takes, is if they're not feeling quite right, depending on their age, give them a pillow, give them a blanket, have them lay down off to the side for a while until they feel better.
Yeah, great point, Steve. I always encourage our clients to use a seizure log. So this is something that you can use to document the norm of your seizures, right? How long do these symptoms usually last? What does the seizure actually look like? So you can share that with any sort of care staff like teacher. So I'm not sure if the rest of our team can maybe share the link for the seizure log on the Facebook page. That would be great. We do have another question from a parent. So it says, by returning to in-class sessions with health and safety measures in place, how does this impact our current bubble? If it currently includes grandparents, other family members who don't attend our children's school, etc., does returning to school put other members of our bubble at risk?
So it's a really great question, and one that we're commonly getting. And so once children are back at school, their bubble will expand because they will be around other children in the school. So decisions around contact with other high-risk individuals in the household and otherwise, it would need to be a decision by the family, sort of taking into account the local epidemiology and weighing any risks and benefits. And even though the child's bubble expands by being at the school and around other kids, we still recommend that people maintain their own bubble, and that just because a child's at school doesn't mean that you should necessarily extend the bubble in the home life as well. It is still important to maintain that and follow the public health advice and recommendations around there, but it will mean that the child is potentially exposed to a larger bubble of people, although mechanisms are in place, and one of the health and safety measures is to keep children cohorted to a certain degree in school to reduce those exposures. But I would make those decisions about other high-risk individuals in the house really case by case, driven a lot by what's happening in the local epidemiology and cases in the local community to understand what that risk is, and then weighing the risks and benefits of those interactions.
All great points. Thank you. It sounds like parents need to think about a lot to consider the safety of their bubble, but that really helps. Thank you. Okay, let's see. So next question is, screen time is a trigger for my child's seizures. What can I do to address this during virtual learning? I don't know, Dr. Kerr, maybe you have any suggestions for that one? Oh, there we go.
Am I unmuted now?
You are, yeah.
Yeah. So I gather that they've chosen virtual learning, and so they must have weighed the pros and cons of the seizures. So you are at home, you should be monitoring your child, but really making sure that you make use of the breaks between official lessons and computer time, so that they're having that break from the computer. It sounds as if the online learning is going to have a lot of instruction now, which is great. And then there's going to be a downtime where the children are doing activities. So when information is assigned, it might be that you can print it out and your child can do the work old school, paper and pencil, and that you can make a copy of it and send it back into the teacher as well. So using the screen time specifically for the instruction and then taking a break from it at other times.
That's a great point. I think technology is so accessible, and sometimes we forget about back to basics. Just a paper and pencil can be helpful too. Great point.
Just one thing to add to what Elizabeth has said, the idea of printing it out is brilliant. It really is. Make it a combination of virtual and being at home as if you're in a real classroom. Keep your eye on your child. If they're starting to show signs of seizure activity, regardless of where they are in the lesson, by all means, step away. Just say, you have to stop now. And as an accommodation, make sure that the teachers, again, know that this could be a trigger. The refresh rate on some computers is fast enough that it's unnoticeable, and on other ones, not so much. And I've seen my daughter, even as an adult, start having seizures from doing an online course for work. Step away, then ask for an accommodation from the teacher. Say, he's not going to be able to do the full session today. How about we agree on the first 15 questions, not the first 30? And modify your expectations of your child's ability to their best, not what's going to put them over the edge.
Yeah, great points. It sounds like, listening to your body, taking a step back when you need it, and asking for accommodations when needed. All right, so the next question says, should I reach out to my neurologist for a letter regarding my epilepsy? If so, what should it include? So I think maybe they mean like a letter to give to the school from the neurologist. Sorry, I'm just still getting the question typed out here.
So a lot of schools do require a letter from a neurologist, and the neurologists are pretty aware about it. So really what they want to see is what the seizure looks like, how frequently the seizures they're having, are there limitations in terms of physical activity or participation in some way, what medications are being used, and what should they do if there's a seizure. So that's something that you're developing as well, but oftentimes they like to have it as a letter from a neurologist. And it's just backup, really, and particularly if there's rescue medications that need to be given, then there's a medical documentation that states that. So usually those documents come home about the first day of school, truthfully, where you're filling out forms or you're getting your neurologist to do them. It's pretty early on, and it's just so that they're ready to act. Again, that's the communication piece. Some teachers have seen a seizure and they think that they've seen all the seizures, not recognizing that epilepsy is so individualized. And so it's your opportunity to really describe what your child's seizures look like. What's the safety plan that you would like them to follow?
All great points to consider. Yeah, thank you for sharing, Dr. Kerr. It looks like, oh, I think I might have disappeared. It looks like Dr. Andrade had commented what to also add. Thanks for joining us, Dr. Andrade. It looks like she's watching. There is another question. Her comment will be in the comments. I can't see it at the moment. But the next question says, a lot of people are using lanyards for children to carry their masks around their necks when they're outside at recess. Is this a safe and sanitary way of handling masks at school? Maybe Dr. Science, that one might be for you.
Sure, yeah. So I think, one of the concerns with lanyards is that they could be choking hazards. So I think that if you are using a lanyard, it's really important to make sure there is a safety release mechanism in place. But as you mentioned, there are some concerns about the sanity with having it around the neck or wearing it as a wristlet, because it can more easily potentially get dirty from playing outside, et cetera, and not being in a safe place. So, I think probably storing it in a plastic bag or in a bag that the child can keep on them, so either in their pocket or a fanny pack, may be a better way to store the mask during the school, and just making sure that the bags are labeled in case the bag falls out. But having it in a bag or some sort of container will help to keep it more sanitary, as opposed to potentially getting dirty playing in the playground.
Great points to make, thank you. So we will be wrapping up shortly. So if anybody has any last minute questions, now is the time to ask them. So just to get to another question here, this one says, how do we prepare students for the new school year when kids want to be social and they want to be with their friends?
So I think talking about distancing and the role distancing can play to prevent infection spread, but also acknowledging that some social interaction is important and is an important part of emotional well-being as well for students. So I think there is a bit of a balance. There's a bundle of health and safety measures that are being put into place to protect children in school. Physical distancing is one of those measures, but yeah, I think just talking about it as an important way to protect, but then talking about all of the other measures that are also important, like washing your hands, the mask wearing that's being encouraged, not sharing stuff between friends, sharing water bottles, sharing foods. Those sort of strategies are also important. So really just emphasizing the bundle of measures, and not being too critical and expecting sort of perfection from students, where those interactions are really part of their nature.
Absolutely, great points about explaining, what is going on in a kid-friendly way. Absolutely.
I think there's also something to be said for, some kids might be feeling nervous about others who might push them to bend rules, or who might infringe on their space. I was a real rule follower as a kid, so that's the sort of thing that I know I would have been kind of like, but what about the others? And so that's where there's a lot of room, I think, for thinking about it in advance. You can do some role playing, not in like a really aggressive way, but just in a, oh, so if that happened, what do you think you might do? What do you think you might say? Practicing some language so that if something happens on the playground that your child feels uncomfortable with or wants to stop, they kind of have a sense of, oh, these are words I could say that might gently but firmly put my boundaries in place. And that's great learning broadly, right? In terms of establishing what are my healthy boundaries and how do I communicate to those to others in a way that they can receive them safely.
Great point. I'm sure that's a lot of children's concerns about how their boundaries differ from their friends. So great suggestions. Thank you. Okay, just a few more questions here and then we'll wrap up. So the next question says, would a blue light screen for my computer monitor help with seizure triggers? I know I can speak to, we have had some of our clients wear blue glasses and they have found it to be helpful if they have photosensitivity where their seizures might be triggered by lights. So that is something you could speak to your local agency about. I can't speak on the blue light. I'm not sure if any of our panelists can. No, okay, that might be a question for your neurologist. So if your child does have seizures that are triggered by lights or computer lights or what have you, bring it up to them to see if they think a blue light on a device might be helpful. Okay, and we answered a few of these. Okay, it looks like the last question that we haven't answered says, what are the regulations around picking my child up if they have a seizure at school? I'm not sure, Dr. Science.
Sure. So I guess it depends. I'm not really sure if I'm going to answer this correctly, but so I guess if you have to go into school to pick up your child, there are the masking requirements in school or recommendations. So anyone going into the school, it would be important to bring the mask. They would also be making sure that anyone coming to the school doesn't have any signs or symptoms of COVID-19. So those would be sort of regulations about going into the school to pick up your child if they had a seizure. I'm not sure if that answers the question or not.
I think so, for sure. Making sure that parents also remember safety measures when they are entering that space, for sure.
Quick question for that. When you're concerned about or wondering about the regulations for picking up your child after a seizure, is in some cases you want to because you know they're going to do better. In other cases, you might not want to because you want them to recover and continue on with their day as most neurotypical students do. As far as regulations go requiring you to pick them up, that is a tough one. It really comes down to a as friendly as you can be, conversation with yourself and the principal about what the protocol will be for your child as outlined again in the safety plan that everyone here tonight has referred to, your conversation with them. I honestly don't know of a specific regulation that says you must pick up your child. Again, I think that has to be a conversation with the principals and if need be, senior staff at your board.
Absolutely. I know from our agency standpoint, we always encourage children, if they're feeling well enough after a seizure, to stay if they feel okay. And that's obviously, like you said, sort of a case-by-case basis. But definitely something to talk to the school about. And as I've already said, if If the school does need help with interpreting any letter from the neurologist, please let us know, as we can help sort of clear up any blurred lines with the communication there and what that child's specific seizure protocol is. Well, it looks like that is the end of the questions. So we will wrap up our webinar. And before we do, I really want to thank the 4 of you for taking the time, especially in the evening, to join us. I know I've had so many questions from parents and so many concerns about going back to school. And so it was really, really nice to have such a multidisciplinary team here at our fingertips to help answer these questions. So we really, really appreciate it. So thank you so much, everybody. So for everybody watching, as we said, there should be resources listed in the comments. And if there was anything you missed that you did want clarification on, please feel free to contact your local agency or your neurologist if you have any medical specific questions about your child, and they would be happy to help you. All right, everybody, well, enjoy the rest of your night, and good luck to all of our families watching with going back to school. We wish you the best and the best of health. Good night, everybody.
Good night.